So Clostridia bacteria. So we know it is gram-positive because we're still doing the gram-positive. It is a spore-forming bacteria that includes many pathogenic species, commonly found in the soil, water, and sewage, and some are found in the GI tract of humans and animals. Okay. Vegetative cells are rod-shaped and arranged in pairs. So, as you can see in this picture, they are rods. Okay. Can you see them? So, remember we said there's gram-positive cocci, rods, and the branching filaments. For cocci, we were done with streptococci and staphylococcus. Then for bacillus, we were done with bacillus. Sorry, for the bacilli, which are the rods, we are done with bacillus. Now we are doing Clostridium. One thing to remember, anaerobic. Anaerobic, okay? The rest are aerobic. Corynebacteria, bacillus, those are aerobic. These ones are anaerobic. Classification, we have Clostridium, sodeli, perfringens, difficile, botulinum, and tetani. So what is relevant to us are these four: perfringens, difficile, botulinum, and tetani. So we start with perfringens. It has a good name, perfringens. It is the most common cause of foodborne illnesses. So basically food poisoning. Mostly found in the intestines of humans and many animals, and is present in soil and areas contaminated by human and animal species. Clostridium perfringens. Okay, as you can see here, it is rod-shaped. The most important thing I want you to remember for Clostridium perfringens is food poisoning. If I was to give you a summary, perfringens, food poisoning. Difficile, diarrhea. Botulinum, botulinism, okay, or botulism. Tetani, tetanus. That's the summary. Okay. So perfringens, food poisoning. So normally bacteria are found on food after cooking. So when you eat improperly cooked or stored foods. So remember, we have to cook at very high temperatures to destroy this bacteria. So once you eat them, it goes, multiplies, and causes food poisoning. The common foods are meats, meat products, and gravy. The symptoms are usually intense abdominal pain and cramps, watery diarrhea. Okay. We're going to be doing a lot of bacteria, and you're going to see there are some that cause bloody diarrhea and some that cause watery diarrhea. For those we have done, they all cause watery diarrhea. Then something to add is it causes something called gas gangrene. Can you see in this picture? So if you are to look at this patient, you can see this is the skin, and then there's something like a vesicle. Okay, it is black and there's fluid filled here. It's actually not fluid, it's actually gas. Okay, this is what we call gas gangrene. Okay, it produces a toxin called alpha toxin. Okay, Clostridium perfringens produces a toxin called alpha toxin. And in this alpha toxin, there's something we call lectinase. Okay, lectinase. So this lectinase is what is responsible for this, because it will cause necrosis. And the type of necrosis is called myonecrosis, where it involves the muscle too, leading to gas gangrene. So when you touch this, you will feel something like bubbles. Okay, that is the gas. Okay, so the bubbles, we call them crepitus. So if you see something like crepitus on the skin, that is Clostridium perfringens. Okay, but the most important thing I want you to know is it causes food poisoning and the gas gangrene. Just that. It's not hard. And then you'll have to remember that this abdominal pain, do you think it will be early in onset or late in onset? Will it be early onset intense abdominal pain or late onset? Some are saying early, some are saying late. So the answer is late. Now, let me explain. What I want you to know is, if you eat something that has preformed toxins, for example, Staphylococcus aureus, after eating Staphylococcus aureus, food that has Staphylococcus aureus, there is already preformed toxins. So that will be early onset. After 2 hours, you start vomiting, you start diarrheaing. But if you eat something and you start diarrheaing after, let's say, 8, 9, 10, 11, 12 hours, that is, you have not eaten the toxin. So in this case, for Clostridium, you've eaten the spore. Now what is going to happen is the spore will go into your system, germinate into bacteria, then the bacteria will release the enterotoxin. That is what is going to cause the late onset, intense abdominal pain, and watery diarrhea. But for bacillus, as we had seen earlier, you're eating the preformed toxin, okay? Similar to Staphylococcus. That's why it's early onset. Have you understood? Okay. Then how do we treat it? So you manage complication until it passes, because remember, it is caused by the toxins. So you can't start giving antibiotics. Dehydration caused by diarrhea and vomiting is the most common complication. So you have to give IV fluids. Don't use medicines, including antibiotics. You can't use antibiotics because it won't help. Okay, because here we're talking about the toxins. For the gas gangrene, what usually happens is they are taken to surgery. Then we do something called as debridement. So debridement is where we go, remove the dead skin tissue, and then we expose it for it to heal. Okay. Then because this one, it's cutaneous, we can use antibiotics. Okay. Take home for Clostridium perfringens. It causes food poisoning because you ingest the spores, which goes to germinate, releasing alpha toxin, okay, known as lecthinase, causing diarrhea and abdominal pain, and it can also cause gas gangrene. Okay. Clostridium difficile. So for this, I also want you, let's read here. So Clostridium difficile, gram-positive, spore-forming bacteria, anaerobic, motile, ubiquitous in nature, especially prevalent in the soil, and they're rod-shaped, as you can see here, occur in pairs or short chains. Infection. It causes one infection. So what I want you to understand in Clostridium difficile is it causes watery diarrhea and abdominal pain. So the mechanism is different here. So here, what happens is Clostridium difficile occurs naturally in our body as normal flora, okay? Normal flora or gut microbiota. But when we overuse antibiotics, we are going to kill the good bacteria. And once that happens, this Clostridium difficile is going to multiply. Okay? And once it multiplies, it becomes pathogenic. That is what is going to cause the watery diarrhea and the pain. Okay? Have you understood? So what usually happens is these Clostridium difficile release toxins. The toxins are, we call it toxin A and toxin B, and they go damage the enterocytes. As you can see here, this pattern is known as pseudomembranous colitis, where you can see these are yellow plaques on the inside of the intestines, okay? And once you have this, you now start having watery diarrhea, okay? So if you see a question, they tell you that a patient has been misusing antibiotics or prolonged use of antibiotics, you know the answer is Clostridium difficile, okay? And then how we diagnose it is, since we are looking for the toxin, we can't actually culture this because you're not going to see anything. We look for the toxins via PCR. Okay. Then how it's treated, antibiotics are the mainstay to treat C. difficile. Commonly used is vancomycin. So what happens is we use oral vancomycin. As you're going to know in pharmacology, vancomycin is never given orally because it has very poor absorption. But in this case, we are going to give it orally because we want the vancomycin to stay within your intestines so that it can work on this Clostridium difficile. That's why we give oral vancomycin. Vancomycin is usually given via IV due to its poor absorption. Okay. We can also give metronidazole, vancomycin. And then there's a new treatment. Let's say treatment with vancomycin has failed. We usually do something called fecal microbiota implant, where we go take pieces from a donor, then we implant it in your intestines. What happens is the feces obviously the feces will be screened for any bacteria or any pathogens. If it's good, it's going to be implanted in your large intestines. Then the good bacteria will start multiplying. Okay? Understood? Are we clear on C. difficile? Good. Botulinum. So botulinum, gram-positive rod-shaped anaerobic spore-forming motile bacteria with the ability to produce a neurotoxin, botulinum. I'm sure this you have heard of it before you were taught, the botulinum toxin. It is quite common. It has a good, a positive outcome. Why I say that is because this is what we call Botox. Have you heard of Botox? For people who are doing like the plastic surgery, like for example, in the face, when you want to do like lip fillers or things like that, it usually prevents wrinkles. So I'm going to explain how that occurs. So for the Clostridium botulinum, it produces a toxin that attacks the body's nerve, causing difficulty breathing, muscle paralysis, and even death. So how this toxin works is the toxin will go attack the nerves, go to the neuromuscular junction, and prevent the release of acetylcholine. We know that acetylcholine is a neurotransmitter that is needed because how nerves communicate is they release neurotransmitters, go to one nerve, then cell signaling happens, then whatever you want to do, let's say you want to move, okay, that is going to happen via that conduction. So that all that process is the nerve conduction process. But now in this case, what happens is acetylcholine release will be inhibited. And once that is inhibited, we're going to have muscle paralysis because you cannot move your muscle if there is no nerve conduction. Okay. Now, if you were to notice, it will cause double vision. So why is it causing double vision? This is because it is affecting the muscles of the eyes. So you're going to get double vision. You get drooping eyelids, as you can see in this person. So the muscles of his eyes, these ones, levator palpebrae, they'll start drooping because he cannot control them. Then muscle weakness in general. Then difficulty swallowing. Once the muscles of the throat, the esophagus are affected, there'll be difficulty swallowing. We call this dysphagia. Blurry vision because you're getting double vision. Slurred speech, these are muscles of the pharynx and larynx have been affected. Then difficulty breathing. Once your diaphragm muscles have been affected, obviously you'll get difficulty breathing. Difficulty moving your eyes. once they cause drooping. So if you are to see, we usually call it the 5 Ds. Diplopia, which is the double vision. Dysarthria, which is difficulty speaking or the slurred speech. Dysphagia, which is difficulty swallowing. Dyspnea, which is difficulty breathing. And then we have something called descending muscle paralysis. What that means is the muscles of the head and the neck are affected first as it moves downwards. That is how this botulinum toxin works. Okay. So the 5 Ds of botulinum, we start with diplopia, dysarthria, dysphagia, dyspnea, descending, muscle, flaccid, paralysis. Okay. How is it treated? So doctors treat botulism with a drug called antitoxin, which prevents the toxin from causing any more harm. Antitoxin does not heal the damage the toxin has already done. Depending on how severe the symptoms are, you may need to stay in the hospital for weeks or months before you even go home. Okay, so once the toxin has done its effect on the body, it's difficult to treat, but the antitoxin is used to prevent further damage. As you can see in this guy, he is unable to move his limbs. Okay, and him, you can see the drooping eyelids, maybe he has double vision. Okay, now, as I was saying, you've heard of Botox. What usually happens is in patients, it's used in plastic surgery in patients who, let's say, if you have wrinkles and you want to get rid of your wrinkles, for people who have hyperhidrosis, which means you sweat a lot, or if you have muscle spasms on the face. So we inject you with this botulism toxin. It will cause muscle paralysis, so you won't have that muscle spasm or the wrinkles. The wrinkles won't form. Okay. Then one thing I want you to remember that I didn't indicate is we do not give children younger than 1 year old honey. The reason is this honey usually contains the spores of this botulinum toxin. So if you see a child given honey less than 1 year old and develops these symptoms, you'll know that it is botulism toxin. Okay, we call it floppy baby syndrome. Okay, then in adults, apart from this, if you consume food that has this preformed toxin, the toxin for botulism. Okay, let's say, for example, in canned food such as pineapples, beans, okay, you're going to get these symptoms. Is it clear?
I have a question.
Yes.
Since you said it's used for Botox surgery, then how sure can we be that it wouldn't like affect other muscles, like except the ones that the target muscles?
Because the dose is regulated, and it is, you see where the injection is, like where you're placing the toxin itself is a very specific area, and the dose is regulated so that it can't spread to other areas. Okay, so if it's, let's say on the left eye, you have wrinkles on your left side of the face, so the dose is regulated and it's only injected in that area for it to work. Okay.
Yeah, okay, thank you.
So are we clear with botulinum, Clostridium botulinum? Then we go to Clostridium tetani. This is, I think, the last one. Yeah. So this is a quite common bacteria. I don't know, I'm sure you've heard of tetanus. You see people getting tetanus. So this is the agent that is responsible. A common soil bacterium, the causative agent of tetanus. Vegetative cells of Clostridium tetani are usually rod-shaped, up to 2.5 micrometers long, but they become enlarged and tennis racket or drumstick shaped when forming spores. Okay. So for Clostridium tetani, what I want you to know is it produces a toxin. So all these Clostridium, they are all spore forming and the spores produce toxins. So the toxin for Clostridium tetani is known as tetanospasmin. Tetanospasmin. Okay, tetanospasmin. From the word tetanospasmin, you can know what it does. Okay, so it's usually the opposite of botulinum. For botulinum, it causes paralysis. For this one, it causes spasm, or basically stiffness. Okay. So spores of tetanus bacteria are found everywhere in the environment, including soil, dust, and manure. The spores develop into bacteria when they enter the body because they're going to germinate. As you can see in this patient, he's going to step on this. Normally, where you get tetanus, commonly, even before you were in med school, you'd know. If you step on a rusty nail, it's going to, so the spores are going to enter your blood system, go and cause production of the enterotoxins, okay? Tetanospasmin specifically, okay? So how this tetanospasmin works is it is going to spread to the CNS, okay? Once it goes to the CNS, it causes the release of GABA. So GABA, sorry, the blockage of GABA. GABA and glycine are inhibitory neurotransmitters. And their function is, you know, what happens is, if I were to give you some history, is these neurotransmitters work hand in hand. There's the excitatory neurotransmitters like glutamate, and there's the inhibitory neurotransmitters. They all work hand in hand. For example, I want my muscle to contract. What will happen is I will cause increase in the excitatory neurotransmitters and decrease the inhibitory neurotransmitters so that I contract the muscle. When I want the muscle to relax, what will happen is I will increase the inhibitory, reduce the excitatory. Okay. Now this one, what is happening is it is blocking the inhibitory. Okay. So the muscle will be tensed because we're saying once you have inhibitory, the muscle is supposed to relax. But now this time, it's blocking the release of the inhibitory neurotransmitters. So the muscle will remain tensed. The excitatory will continue working. So that is why you're going to have spasm. So spasm is like kind of pumping. I don't know if you've seen the muscle. It's like it's pumping, it's moving up and down, up and down. That is the spasm. Okay? And then it becomes stiff, especially at your jaw. We usually call it lockjaw, trismus. It's usually called lockjaw, where your jaw is going to be locked, literally, at the abdomen, chest, back, and neck. Okay? The muscle becomes rigid or stiff. Then obviously you're going to have difficulty swallowing because you cannot move your muscle. So how is it treated? It's typically treated with a variety of therapies. So cleaning the wound in case, let's say you stepped on a rusty nail, antibiotics, for example, penicillin, then tetanus immunoglobulin, and then they have the tetanus vaccine. So tetanus is not quite common these days because we have the vaccine. So tetanus IgG, these are immunoglobulin. So these are antibodies. So once you get this, so this is more of an active vaccine, okay? So it provides active immunity. Then for the tetanus vaccine, usually a booster. Let's say, for example, especially given to mothers, so that, let's say, for example, the mother has been exposed to this, or before, you know, a vaccine is usually given before. You give the mother a vaccine, and then it crosses the placenta, goes to the child, protects the child. Okay? Are we clear? And then we have muscle relaxers, because remember, your muscle is very stiff. So you give muscle relaxers so that the muscle can relax. And then obviously when you're cleaning the wound, so it depends the extent of the damage of the wound. If it's damaged badly, we can go do surgical debridement, where we remove the dead tissue from the wound. And then as you can see in this person, you can see he's in a locked position. So all his muscles are very tensed and rigid. He's formed this arc. This is very classic of tetanus. So questions for Clostridium tetani are usually direct. Like they'll tell you, if you are barefoot, step on a rusty nail. Okay. The spores are usually found on the soil or on this rusty nail. Okay. Yes. So that's for Clostridium tetani. Then this is a summary for all you have done. So we know they're all rod-shaped, they're all gram-positive. Some colonies may have convex shape, with a few having spherical or irregular shape, have peritracheous flagella, especially Clostridium perfringens, short, thick forms to large gram-positive rods with rounded edges, ends, single chains, small bundles, that's perfringens, filamentous perfringens, capsulated perfringens, non-motile perfringens, drumstick appearance, tetani, pleomorphic tetani, non-encapsulated tetani, motile petrificus flagella, tetani. This is a very good summary. So in case they ask, then this is also a good summary. Clostridium perfringens, as I said, food poisoning, tetani, tetanus, ignore this one. And then botulinum, it causes botulism, where basically there is muscle paralysis. You remember the 5 Ds. Okay. Yes. And I'm done for Clostridium. Do you have any question?